Brilliant. So I think we're going to get started. Welcome, everyone. For those who don't know me, I'm Lisa Langford. I'm the Global Partnership Lead at Turn, and I'm speaking to you today from sunny London. Believe it, because it is actually quite sunny here, which is quite unusual. We're all welcoming you today for joining us from wherever you are on the globe. We're so excited to be sharing some really interesting use cases with you today, and also some amazing and very exciting product feature updates that we are very proud to showcase today. Before we get started, if you have any questions, feel free to raise your hand in the chat or just drop your question in the chat. You can also unmute yourself. This is an informal discussion, and we'll give times throughout the session to ask questions. So just unmute yourself and we can have a good discussion. Do keep in mind that we are recording this session, so we will be sharing this version of the recorded session with you in our community forum, but also in our LinkedIn community. So without further ado, I would like to hand over to our first guest speaker today, Marita from 1000 Day Fund. Will be sharing her use case with us and how they've been using WhatsApp to have impact. Over to you, Marita.
Thank you so much, Lisa, and hello everyone from Bali, Indonesia. It's night tonight here in Indonesia. That's why my face is a little bit pale, because there's a light in front of me. But I'm very excited here to be here and talking to you about what we do with our chatbot and how we try to prevent stunting using our chatbot. So 1000 Days Fund, we focuses on stunting preventions in rural area in Indonesia. Indonesia is one of the 5 highest stunting rates in the world. So it becomes a national priority for the Indonesian government to reduce the stunting rates here in Indonesia. 1000 Days of Fun creating the innovative tools that you can see on the pictures and also in my background that called Smart Charts. And this is a cost-effective stunting prevention tools that bring solution to in-home first 1000 days of life counseling and train community health workers, or as we call it, Kader Posyandu, to be more skillful and confident. And can you go to the next slide, please? So here in Indonesia, there are approximately 1.5 million community health workers across Indonesia, and are almost exclusively, all of them are female with elementary school educations. Prior to deployment of their service as community health workers, many of them never received formal training and lack continuous on the job training. Yet their presence is very critical to ensure the continuation of essential delivery and preventative measures of stunting in rural areas. There's upskilling and formal recognition such as certification is very crucial, so that they could be more skillful and more confident and can give a better quality of care of service in a health as a health providers. So we want to train and to reach them better all over Indonesia. We do have a brick and mortar kind of methods, but we wanted to reach a bigger populations because there are so many of them, and we want to reach as much as possible. Hence, chatting that the chatbot is a go-to stunting preventions that is designed for community health workers and also caregivers to get information about stunting prevention on their mobile phone. So our chatbot is the first ever stunting focused chatbot in Indonesia, and it's an infobot that targets 3 main audiences. The first one is the community health workers, so that we can train and certify them, and hopefully that will also contribute to their overall welfare. And the second one is to help health workers whom employed by the government, so they can also get to join in and write on the action of the stunting preventions by us giving them the smart chart that you can see on the background, so they can also have a stunting prevention programs in their regions, and as simple as chat us on the chatbot that will help them to get on the action. And the third is the general audience, such as the caregivers. So here are the mothers and the fathers and the grandparents or the neighbors who are on the surrounding the first 1,000 days of life of a child, and they also wanted to be on the action and wanted to know more about something on how and ways to how to prevent it. So our chatbot will give informations about the stunting, the first 1,000 days of life, and even myth debunkings during laboring, breastfeedings, and overall first 1,000 days of life of a child's life. And we wanted to see this chatbot to be used by millions of community health workers that is in Indonesia. Offline, we have trained about 5,000 community health workers during the lifetimes of our organizations. And we feel that chatting will definitely scale to the places or even to the numbers that we hadn't reached before. So next, please. So we only have our chatbot for several months now, but the reception has been wonderful and we'll learn a great deal during the development. So here are, I think, a few tips that might be useful for first-time chatbot developers. The first one is that plan ahead. I think in our organization, the two of us who developed the chatbot, none of us have a coding skills, but we plan to be able to project present the projects really carefully, so that the programs that we wanted to have on the topic is very focused, and it helps to bear in mind the type of audience that we have, since most of them are elementary school graduates and probably older. So we always bear in mind to be user friendly and to be able to have a topic that is just very easy to understand. And also the test is very important for us, again, since our audience and in the remote areas and older, and also have a maybe lower digital literacy. So we wanted to test with the audience, even the toughest crowd that we have, we started with them. And the last one, I think the key learnings is that even though there are several channels that you can use to advertise your chatbot, we haven't used paid ads, and we felt that the Wami links through WhatsApp groups, because WhatsApp groups is big in Indonesia, even in the remote areas, we've been using those quite tremendously, and it's been gaining results. Next, please. Thank you. So here is a bit of a sneak peek about our chatbot. And as you can see, we are in the main menu where the users can choose what type of topic they want to learn, and whether they want to learn about the quiz or be certified as a community health workers. It's a fairly easy kind of programs that we have in the chatbot, and it's just sort of like a normal conversation and normal dialogue. We created it as concise as possible, so that they don't have to read a lot, and they don't have to click on many numbers or letters. And with the buttons and the features that's already there on the WhatsApp chatbot, it's been helping the community health workers to be certified even fast, and in this sense that they can have more time to learn about the stunting rather than to worry about if they can pass the certification or not. Yeah, I think with the chatbot is that we do not want this to be just like jumping on a trend on a digital or tech with health. We do believe that chatting, the chatbot that we have, can turn a tide in the stunting prevention in Indonesia, because no other NGOs are obsessed with training health workers like we do. And this is just another avenue for us to reach more scale, to reach other that we haven't reached before, so that in our communities that no one is left behind. So yeah, thank you so much for the opportunity to share about chatting, and it's my pleasure to be here.
Thank you so much, Marita. I really like how you say that you're not from a coding background, which just shows that anyone can build a chatbot service. You don't have to be an engineer, and as long as you have a good understanding of your users' needs and what tools you can provide them to help them solve those problems, I think you've done a fantastic job. A question from my side before we open up to the rest of the group for the questions. You mentioned your marketing efforts where you just shared the click to WhatsApp link within WhatsApp groups. Tell us a bit more about that. How did you get into that? And what other channels are you thinking or considering next to drive users to your service?
Yeah, it was because that we do Indonesia, as I said, like the WhatsApp group, it's been very, they use it very religiously. So we do send the WAMI link through the WhatsApp group, and that's how it gets snowballed into the numbers that we have currently in our users. But also at the same time, I think we can hit a block and run out of WhatsApp groups that we can share. So in the future, we definitely thinking about doing paid ads to reach a bigger audience. We use Instagram also, and we felt that most of the community health workers are also tuned in and connected with the Instagram and other platforms, social media platforms. And we're also thinking about reaching with Facebook groups, for instance. We do have to reach them one by one. That's how we felt the best way, because we just do not want them to stumble upon ads. And we thought, because most of them are in the remote areas, we do have to reach to them one by one. But yeah, so far it's been great.
Fantastic. Thank you so much. Yes, we have some time now. If there's any questions from the community to Marita, feel free to pop your question into the chat or unmute yourself. I'll give you a minute or so. Otherwise, if you do have a question later, we will have another slot for you to ask them. Just having a look at the chat. Here's a good question from Candice. How important is it to make sure your audience are actual healthcare workers? Do you validate them who they have access?
Thank you so much for the question, Candice. I think at this point, stunting is still a mystery for many of us. So we want the information to be known as wide as possible. So if it's about the program and if they wanted to be involved in the program to install the smart shots, for instance, yes, we have to validate that they are healthcare workers, because we do want accountability in the program, so that when we gave them the tools, they put it up and they follow it through. But in terms of accessing the information with the chatbot, we don't need to validate them, because we do want as much as general audience, as much as people as possible to understand the condition and to be able to participate in the prevention of stunting.
I don't see any other further questions, but keep them coming. We will make some time for the end for if you want to ask questions to Marita. Thank you again so much, Marita. Best of luck. And we look forward to see the service scale. I think it's such an important course. We're 100% behind you on that. Then moving on to our community members, I'm going to hand over to Kanya now, who's going to be chatting about our latest members joining.
Thank you very much, Lisa. And hello, everyone, once again. I'm excited actually to welcome our newest community members, and I'd like you to look at the next slide, please. So first up, we have Seven Sugar, which is an organization that's based out in India and focuses on digital therapeutics and AI. So they use artificial intelligence to learn patient physiology and behavioral patterns to deliver lifestyle interventions to diabetic patients. Their chat service on WhatsApp is aimed at helping these diabetic patients with their journey and provide valuable and easy access to relevant information such as glucose levels, nutrition, and so on. We also have Maternity Foundation, which is a Danish organization that started in 2015. They currently have 3 other country offices and operate in 15 countries across sub-Saharan Africa and Southeast Asia. The foundation works to improve maternal and newborn health through scalable programs and digital solutions. Now, these initiatives are aimed at empowering birth attendants, pregnant women, new mothers in low and middle income countries. They are looking at building a WhatsApp chat service to support some of the work they're doing currently in India. Lastly, we have the Committee to Protect Journalists, Now, this is a great organization which plans to use WhatsApp to share safety information directly with journalists. They will start by using the information they've already been sharing with journalists in Ukraine and will let users choose options of receiving physical, digital, or psychological safety information. They will also provide the option for journalists requiring more direct assistance to contact someone from the CPJ team directly. Next, please. Now, as part of our community, we're actually quite excited and would like to extend a very warm congratulations to two of our community members, namely Care International and Sesamo Workshop. These organizations actually won at the Shorty Awards, where the Care organization won the Best Chatbot Award. Now, these awards honor brand agencies and organizations that are effectively and creatively using chatbots on social and digital platforms to enhance their customer experience. So the Care International team built their chatbot to support some of their efforts in Afghanistan. And we've showcased them before actually on our town hall showcases, where they built their service within 4 days and has been a huge success. So congratulations once again. The Sesamo team also built a chat service as well, where they helped children in Peru by increasing access to playful, evidence-based educational content, and have used WhatsApp as well to scale and meet users where they are. So a huge congratulations, and we look forward to many more winners as well. I'll now hand over to Indrani.
Hello, everyone. Hi, everyone. I'm Indrani Vedula, and I lead Impact Partnerships for Asia-Pac and India. We devised the Chat for Impact initiative with the aim of supporting and accelerating the work that social impact organizations such as yourselves are doing to provide vulnerable, disempowered, and minority communities with easy and secure access to vital information and support via WhatsApp. The Chat for Impact initiative includes an annual events calendar with monthly boot camps, as well as ongoing engagement activities with our 1,000+ members strong Chat for Impact community. On a monthly basis, we're running short bootcamp sessions, most of which will be focused on smaller cohorts and increased interaction. Themes for the bootcamps will vary each month and will be broken down by impact verticals or regions to help support social impact organizations that sign up, launch their WhatsApp business platform. Earlier in May, we ran the Chat for Impact Health Bootcamp, and over 48 organizations that run health-based services in EMEA and Asia-Pac regions signed up for the bootcamp. Our clients and partners from Prekult.org, 1000 Days Fund, and Nura Health shared their use cases and key learnings in building health-based chat services. The Turn team also shared best practices around content design based on our team's collective expertise in building multiple large-scale health messaging chat services over the years. The event recording is available on the Chat for Impact forum, so if you're interested in viewing it, please do so. Next slide, please. So coming up on June 9th, around World Environment Day, is our next bootcamp around climate and sustainability. We will share the link to register to the bootcamp on chat shortly. Next slide, please. So this bootcamp is aimed at not-for-profit organizations, NGOs, charities, key branches of government and social enterprise organizations globally that focus their missions on promoting sustainable goals, or organizations working in specific sectors relating to climate and sustainability, including climate education, renewable energy incentives, energy usage literacy, natural disaster preparedness and response, sustainable agriculture, green energy, water and nature conservation, prevention of climate change, pollution and deforestation. So if your organization or any organization in your network can benefit from attending this bootcamp, please register and share the link. We will keep you posted on upcoming bootcamps in the next town hall event. During the 1.5 hour session, participants will gain a deep understanding of how to use WhatsApp's business platform for their use case. These sessions will be more strategic and with some focus on relevant tech and product features. Attendees will get an opportunity to fast track the development and launch of their service. In addition, bootcamp attendees who are keen on onboarding during the month of the bootcamp will receive an attractive onboarding offer. And finally, they will get to learn from highly experienced teams who have implemented some of the most effective WhatsApp services out there. And with that, I'll hand over to Neelka for the product update.
Great, thanks Indrani. Hi everyone, my name is Neelka, if I haven't met you, and I will be just sharing 2 product updates with you today. The first one, we briefly touched on it last month, but it wasn't completely ready, and I thought best to chat about it again today. And that is that payments in turn is now made very easy. This specifically, if you're an existing client, you probably used to getting a monthly invoice from us and then having to remember to pay your bills. And what we've done to lessen your admin burden is to make it possible to subscribe to payments. So that means you set up your credit card details and you set up recurring payments, and then, yeah, it's one less thing to worry about in the month. All of this you can find on your settings page in subscription billing, and I'm actually going to share in the chat the article on Learn, then you can still open that and grab it whilst we're online. But the idea is really for you to just have it much more easy, especially if you're an existing client. I think you've gone around the block whether you're using the platform or not. So please have a read through. It allows you to update your financial email that gets these emails and cancellations and all of that. So that's on payments made easy. And then the next product update, I'm very excited to talk about, and I think you guys will be even more excited to hear about it, because it's been our most requested feature to date. So I want to lift the curtain a little bit on what we've been working on hard and behind the scenes. And that is a feature called Reminders. And what Reminders will allow you to do is to reach out to a selected group of people and send a personalized notification. Currently, we're in alpha testing. The feedback is great. And after alpha testing, there comes beta testing. And this is an invitation if you're very interested in doing these personalized notifications on a little bit of a bigger scale than 1 by 1 from the user interface. Please reach out to us on the support line so we can give you early access and we can get your input into how to do this in the best way possible. But without further ado, let's look at a short demo video so you can understand where we're heading with this.
Let's look at how you send reminders in turn. Once you've logged in to your account, you can navigate to the reminders page. You will see your history, or if you haven't done a send, you will have a nice empty state telling you what to do. We're clicking send reminders and it takes us to a search bar. This allows you to search your contacts. You can see an example of how to do that. You can see some tips below, and there's an article that will link you out to our Learn platform that have even more possibilities and examples. So I'm going to look for all my contacts that have opted in as true and whose appointment day for their second appointment is within the month of May. I can see that 3 contacts have been found. They all have opted in. And if I scroll to my appointment day, I just want to check. Yes, 22nd, 31st, 24th. Great. So I'm happy with my search and I'm ready to choose a template. This will show you all your approved templates and you can select the one that you're happy with. I have a nice open chat template. So when you get to the placeholders, this allows you to personalize the message that will go out, and you can use just plain text, but you can also refer to contact fields. To do that, you need to use the @ that tells the UI that you will be using a dynamic variable, and I can say, I want to say WhatsApp profile name. So this will then take whatever the user, how the user referred to themselves on WhatsApp, and then I'm saying that your next appointment is at, and it's contact appointment day 2. So let me just double check. Remember, if you don't have the at, it's going to send the text as is. So at WhatsApp profile name, next appointment is there, and I'm happy. I'm clicking send. There's a notice telling you that you're allowed to do 1,000 sends a day. If you've selected more people than that, the first 1,000 will send today, and then the next batch will go tomorrow until the send is done. I'm clicking OK, noted, and then I have to confirm, double check 3 contacts, opted in is true, appointment day is in May, and I'm sending my open template. I'm happy, so I am sending. Great. Let's see. Yes, did it arrive? Hey Nielke, my appointment day is the 22nd of May. Fantastic.
Great. So that's a long video with a whole bunch of details. Basically, just wanted to make it real. Otherwise, you guys won't know how we think about it at the moment. I am very sure that there's a lot of you very interested in this feature. And yeah, I'm just putting the invite out again. Please chat to Manish on support. We'll get a list together of people interested in beta testing. We build the best way when you guys build alongside us, and I'm sure you have your use cases lined up. And we're very keen to shape this in a very useful manner for you guys. And with that, I'm handing over to Manish.
Thanks, Nilka. Hello, everyone. I am Manish, and I'm Community Manager at Turn. Next slide, please. Last week, we had announced that we'll be reaching out to all of the community members to do some community interviews so that we could have a repository of learning and get to know more about you. We have had an amazing time talking to 8 organizations last month. We thank Oliko Maths Education, 1000 Day Funds, Cyberpeace Foundation, Jhatka, Keradi, IsraAid, CABC, and Impande for sharing their valuable learnings for larger community. Next slide, please. We also want to give you a small snippet of our interview with Cyberpeace Foundation and CABC. Cyberpeace Foundation builds collective resilience against cyber crimes that include sexual, financial, and other crimes, and global threats of cyber warfare. We'll hear one small story from them. It's from the interview that we did with them. Also, in the same video, we'll also listen to the challenges of CABC team that helps create positive behavioral change in society by actively countering divisive, negative, and false online narratives. Let's see this short video, short snippet of our interview with both of these organizations.
I can share, a couple of stories from our helpline. One of the victims reached out to us on our helpline, and unfortunately she was not very educated, so she did reach out somehow. She did type in the message seeking help. So the problem was that she was in a relationship with a guy who had made videos and images of their intimate
encounters, and then they had a breakup, and this guy was now sharing the pictures and videos on pornographic sites. So this girl was about to get married, and then this guy started blackmailing her and threatening her that he had already published the videos, and and that led to the marriage being called off from the victim's side. So she got very panicked, and she reached out to us as how can we help her. So we did take cognizance. She was very much worried, so we had to kind of, and she wanted help, but she was not willing to divulge information.
So that was challenging for us. So our helpline team members actually, connected with her through messaging. We also, kind of counseled her and assured her that, whatever information she's going to share with us is going to remain very, very confidential. We will be only information to ensure that, her case is resolved and we provide her assistance. So what we are aiming at, Kerala, is not just, assisting the victims. We want to counsel them. We want to ensure that, fallen trap once, there should not be, there shouldn't be any repetition. We are trying to create that kind of awareness with our victims. We are trying to ensure that, we are available 24 hours. Like, that's the reason that we said that we're looking at switching over to a chatbot, because right now we are restricted to 9 to 6 India time. But if we are available 24 hours, the delay that happens currently, because in many of the financial fraud cases, the action needs to be taken right away.
I think it's been very much a learning experience for us in terms of trying to figure out the best way to get people to engage with this kind of content. I do think that kind of one of our biggest challenges is that we're dealing with quite hectic issues, and a lot of the time people are kind of like, I'm tired, or I've heard about this but I don't actually want to engage with it, or it can feel quite kind of dark or draining sometimes. So I think that's kind of been our biggest challenge in terms of trying to get people to engage with our menu, to even do that first step of messaging hi, So I think in terms of even just figuring out the ads that we're using to send people to that number, there was so much kind of trial and error around that.
Okay, there are powerful stories, powerful learnings that all the 8 of the organizations they have shared, and we are proud to work with all of you who are doing this amazing job on ground. We cannot wait to talk to the rest of our community members and look out for a full version of these interviews in our community forum, which we'll post shortly. If you have not joined our forum, you can join it via the link provided in the following slide. Next slide, please. Okay, before sharing how can you join community, we have one exciting announcement to make. This month, Simon, one of our co-founders, will be attending the 75th World Health Assembly in Geneva, Switzerland. The event will host experts from around the world who will discuss how current and future initiatives can protect the world from global health threats. This is one of the first in-person events Turn.io will be represented in since the start of COVID-19 pandemic. If you are attending the World Health Assembly, please let us know. We'll be sharing the link for you to live stream the event when we post these slides to the community forum and the LinkedIn thread. Next slide, please. So you can always join the community forum with this link. We'll share this in the forum. It's https://chatforimpact.io. You can always join our LinkedIn group. We post regular updates there, and we do Tuesdays and Thursdays weekly product training. Feel free to join in. And with that, we call it a day. Thank you, everyone.
Thank you so much, Manish and Ilka, for the product update. It's very exciting. I see we do have a few minutes left. So if there's any further questions for the Turn team or for Marita, I see there's some questions that has already been resolved in the chat. We do have some time, so the floor is open to you. While we're looking at some questions here, I like Candice's comment here, which I'll just read verbatim, is just realizing how powerful just saying hi now becomes. Thank you for sharing this amazing life-changing chat initiatives. So right, Candice. We look forward to seeing you all having a great impact with your services. Well, without further ado, that's the end of our May town hall. So keep in touch. Make sure you register and join the communities where we'll be sharing more about upcoming events and how you can get in touch with us. But have a wonderful and safe rest of your month. Bye, everyone.